I actually have a special interest in alopecia or hair loss. And so, inflammatory scarring alopecia is something that disproportionately affects Black women, and that may present with symptoms in some instances: inflammation, itchiness, scaliness, tenderness. And the issue with that condition is um, that those symptoms may lead to scar tissue formation and result in permanent hair loss. And so it's important that it's recognized early. And so we understand what inflammation looks like in patients who have skin of color. So inflammation may not present as typical redness. Inflammation of the scalp may present as hyperpigmentation or darker tone to the skin. It may present as just scaliness. And some patients have no symptoms at all. So recognizing what that looks like in patients of color. Some other conditions that disproportionately affect, we mentioned hyperpigmentation as it relates to hair loss and scalp inflammation, but that's also commonly seen in the skin. And so oftentimes that's a secondary problem, the hyperpigmentation, and oftentimes patients are more affected by that secondary issue of hyperpigmentation than they might be the primary issue. One example of that is acne. For acne, oftentimes the pimple goes away in a matter of days, even weeks, but the hyperpigmentation can last for months. And so patients are much more distressed about that. So in treating that primary condition, such as acne, you also need to make sure you're acknowledging and treating that secondary condition that patients are oftentimes very much distressed by as well.